Hi, my name is Windsor Shuey, and today I'm going to be performing a Foley insertion. I'm going to go ahead and take my badge off just because this is a sterile procedure, but I do have it. To go ahead and begin, I actually got dinged because I didn't show my entire sterile field, which is kind of hard on my table. So you're stacked high on like 12 books, and I'm going to go ahead and reposition this so hopefully you can see everything. That is the goal. All right, perfect. All right, so to begin, I would go into the patient's room, close the curtain for patient privacy. I would ask Mrs. Smith to go ahead and verify her name and date of birth. Mrs. Smith, can you please verify your name and date of birth? Awesome. So today we're going to go ahead and do a Foley catheter insertion. That's what the provider has ordered. Are you familiar with this procedure, or do you need me to explain it in depth? No, you're familiar with it? All right, well, to begin, I'm going to go ahead and clean the perineum, and then I'll step out, get my supplies, and then I'll come back in and we will do the insertion. All right, Mrs. Smith consented, so I would go ahead and perform hand hygiene. I would go ahead and put on non-sterile gloves. I would go ahead and take three different cloths, and I would spread the labia, and I would clean furthest away from me. I would clean closest to me, and then I would clean straight down the center. All right, and Mrs. Smith is falling out of the plastic. All right, there we go. All right, so after that, I would go ahead and I would take my gloves off, and I would go ahead and perform hand hygiene. I would cover the patient with the drape, if there was one, just to ensure patient privacy. All right, Mrs. Smith, I'm gonna go ahead and get my supplies, and then I'll be right back. All right, I went and I got my supplies. All right, Mrs. Smith, I'm gonna go ahead and I'm gonna pull the drape back, and we're gonna open the sterile kit. Please ensure that you don't close your legs or you don't touch anything in the sterile field. So I'll actually have you go ahead and bend your knees and just relax your thighs. All right, Mrs. Smith did that. All right, I'm gonna go ahead and open the kit now, maintaining my 1-inch border. All right, so the first thing on my kit, or in my kit, is this drape. So maintaining that 1-inch border, I would just go ahead and shake this open. Mrs. Smith, can you please go ahead and lift your hips for me? Perfect, she went ahead and did that, and I would place that directly underneath her. All right, next are my gloves. Beginning with my dominant hand, I would pick it up and insert, and then I will scoop and insert. All right, and then I will pinch this, and I will dispose of this accordingly. All right, Mrs. Smith, first things first, I'm gonna go ahead and place this draw sheet over you. All right, so we place the draw sheet over Mrs. Smith, and now I have my kit here. So to begin, I would go ahead and prepare this kit. I would begin by, I would take the lubricant and I would place it over here just to fill this up. I'm not actually gonna open this, but I would fill that up. I would go ahead and get my sticks, my alcohol swabs ready, and I would dispose of this in the trash. All right, next, I will go ahead and get my catheter out. I don't know what to do with that. All right. Make sure that this is all bent accordingly so that it doesn't get all twisted. I would then go ahead and very carefully remove this from the packaging, winding it around. And I would go ahead and take this and dispose of it. I would make sure to dip this into the lubricant so that it is good to go. And then I would take my 10 milliliters of solution, I'll pull the cap off, and then I will go ahead and place this right here. All right, and I'm actually going to try and flip this around so that this is going to be easier to insert. All right. Perfect. All right, Mrs. Smith, we're almost ready to insert. So what I'm gonna do is I'm gonna go ahead and I'm gonna part your labia, and then I'm gonna clean with 3 different swabs. And then I'm gonna go ahead and have you take a deep breath, and then on the exhale, I'm gonna go ahead and begin inserting the catheter. Does that work for you? All right, perfect. So now this hand is non-sterile. I would begin by cleaning furthest away from me, closest towards me, and straight down the center. Next, Mrs. Smith, can you please go ahead and take a deep breath for me? Perfect, and then exhale. Perfect. All right, I see urine, so now I will go ahead and I will insert it 2 more inches. And my thing came unhooked, so let's go ahead and attempt to do this one-handed. All right, perfect. All right, Mrs. Smith, I'm gonna go ahead and inflate the balloon now. All right, excellent. I'm gonna go ahead and disconnect that, and then I'm gonna pull until I feel a resistance. Perfect, and then I'm gonna push it back in just a little bit. All right, Mrs. Smith, your catheter's in, so now I'm just gonna go ahead and clean up. Did you have any concerns or anything like that? You doing all right? Perfect. All right, for the purpose of the fact that I might need to do more remediation, I'm just gonna go ahead and take these off carefully. I would take all of my supplies and I would carefully dispose of them into the appropriate receptacle. I would go ahead and I would attach this to Mrs. Smith's inner thigh, and I would hang this on the bed, not the rail, but on the bed itself, directly below the patient's hips. All right. Thank you so much.